Hi, I'm Dr. Brian Castelein with Brighton Foot and Ankle, and today we're going to talk about persistent plantar fasciitis. You might have heard about plantar fasciitis as 10% of the population gets affected with it, and quite frankly, we have great conservative care options. Our studies show that 90% of people get cured by plantar fasciitis with 3 different techniques that we like to use here. The first, the most important thing, being stretching exercises for the calf muscles. The second thing that we like to talk about is using a firm support, like a good solid orthotic, a good solid shoe, to come in through here and to help stabilize that plantar fascia and help reduce the inflammation and pain. And the third thing that we like to use is some anti-inflammatory medications. Sure, sometimes we put medications into the heel, other times we take some oral medications to help reduce that inflammation. When those 3 things aren't working, well then we like to use formal physical therapy. We have some great physical therapists here in the Brighton area that we like to refer to who can help us again expand upon our treatments and help reduce inflammation to that plantar fascia by working hard on calf muscles and other physical therapy techniques. But for 10% of people, this isn't going to cut it. They're still going to have pain. And for those 10%, we like to talk about 2 different surgical procedures. Both procedures are pretty similar in each other, but they do have some differences. Both are using a camera. We call them endoscopic procedures. And the first one that we talk about is using the camera to release the plantar fascia, or an endoscopic plantar fasciotomy, or EPF if you're in the business. What this means is we take a little camera and we're going to pass it through the bottom aspect of the foot right next to that plantar fascia. We're going to visualize the bands of the plantar fascia, and quite frankly, through that little camera, we're going to release the inside portion of that plantar fascia to help reduce pain. This is a great procedure that takes 10 to 15 minutes. It's outpatient. We put you home walking in a boot the same day. Typically, people are in that boot for 2 or 3 weeks, and typically our patients say that they have less pain the day after surgery than they do the day before surgery. Not saying they're not in no pain, but they're feeling much better. Our second procedure that we like to talk about is a little bit more involved, okay? Instead of working on the plantar fascia and the structures down here, well, we come back up into the calf muscles, and we're gonna really focus on the gastrocnemius muscle. And again, we're gonna take that camera and we're gonna do what's called an endoscopic gastrocnemius recession. Meaning what we're gonna do is we're gonna come into the back portion of the leg, right where the calf muscles start to form that Achilles tendon, and through this area we're going to pass our camera. We're going to visualize the one problematic muscle tendon junction back and through here. Okay, that's called the gastrocnemius muscle, and by lengthening that muscle back here, we're going to allow the foot to come up so much easier, and it's going to be pulling less on that calf muscle. Fortunately, this procedure is also outpatient. It takes like 15 to 17 minutes, so a little bit longer than our endoscopic plantar fasciotomy. But what we do with this procedure is we put you walking home in a boot. This boot, we do have a stringent time requirement where we ask you to stay in that boot for 4 weeks. This one can have a little bit more discomfort into the backside of the leg and into that Achilles tendon, quite frankly, even the muscles up through here. But it is much more powerful, and we like to use that procedure for really persistent pain, as well as if people are developing pain into the ball of their foot. That way we can kind of get rid of 2 different areas of pain with one procedure. Both the endoscopic plantar fasciotomy and the endoscopic gastric recessions are great, powerful procedures to help reduce plantar fascia, and we tailor our procedure to our patients. So come see us at Brighton Foot and Ankle for your persistent plantar fasciitis.